Your health is the most important thing you can invest in. Good morning, guys. This is Dr. Brenden Cochran from Interactive Health Clinic. I will be sharing with you today some proactive and very progressive things that are coming out to both for testing and for treatment options of this current pandemic that we have going on that we need to consider. So let's dive right in to what we have going on. So I'm going to show you a few things today. I'm going to try something a little different. So first thing I want to talk about today is what do we have going on that we knew of. Remember in one of the older about the different strains of this current virus? Well, I said there could be up to 8 different strains. Well, yesterday what we had published is there definitely are 3 strains circulating around. We call this type A, type B, and type C. Type A is the original one that came out of China, was originating from the animal, and then it mutated into type B. Type B is the one that was quickly found in China, circulated around, and then that type B eventually made it out of China off to Europe, where it mutated even more rapidly once it got in Europe. And so type B is the one that has the most virulence, is perhaps the most deadly, and is causing the most problems that you're seeing in Europe right now. The other one is type C. Type C is a little less deadly, it seems, and maybe a little less virulent. So type B is the one that's the worst, and then followed by type A is kind of the middle ground one, and then type C seems to be a little mellower. So what do we have going on in the U.S.? And this is one of the things I wanted to bring up, one of the concerns, why are we getting these dramatic differences on the East Coast versus the West Coast? And most of the news you're hearing, well, we did a successful lockdown and self-isolated much better than they did over on the East Coast. And partly this is true. We did put some precautionary methods into place to slow this thing down. But the other thing that happens is we were on track, at least in Washington State, moving quite quickly, and then we stopped this thing down quite quickly. And one of the things that I was curious with is, how did we do that versus New York State, for example, didn't get a hold of the curve, especially if it's been around for a little while. And then finally I started to get some answers, and I think it's definitely something we need to consider, as it could be something that could change us in the future as we go back into society or try to go back to work. So where did type A come from? Well, we said it came from China. Well, type A is the one that we've genomically sequenced that is now found in Washington and along the West Coast. So mostly what we have over here is type A. What we've sequenced over on the East Coast, however, is mostly the type B. And remember, type B is the one we said came from Spain and Italy and France, the one that's causing a lot of problems in Europe and the one that's currently causing a lot of problems in New York. So what we don't know is most of them are type B on the East Coast, most seem to be type A on the West Coast. What happens in the future going forward if you have not been exposed to type B, but you have been exposed to type A? As some of the people that are getting kind of these mild symptoms or asymptomatic presentations, they may be actually having more type A and not type B. So one of my concerns I share is if we start allowing those people to mix, we may have either another infection or a worsening infection like we're seeing over in New York. Same thing goes on when we have influenza, right? We have influenza A and influenza B, and then we have the H1N1 and H5N1 and all sorts in that setting. And once you've had one, you're still susceptible to getting the other strain. The type B one is the one that's also doing the fastest mutation because it is an RNA virus, which is very synonymous with the cold family and also the influenza family. And the problem with that is it makes it extremely difficult to come up with an effective vaccine, as we have seen that with the common cold, and we have seen that with your common flu shots, which the last 3 years have been hitting around 25 to 30% in efficacy for working. So that makes it a lot more challenging, and that makes it take a lot more time to come up with something that will work, that will also be safe. So I'll share that article below, but there are at least 3 confirmed strains circulating around right now. The type B one is the worst one. Classically, we're seeing the type B in Europe, and then on the the East Coast more. So that was one fact that was particularly concerning. Now, what about testing for people? So right now we have 2 types of tests if you're actively infected. We talked about the nasal swab that you have to get done. It's called a PCR, so it's looking for basically the RNA, and then it says positive or negative. And then another company, I said in a few videos back, offers a stool test, which will drop ship it to your home if you are a patient of a doctor who carries that. And then they'll test if you're positive or negative, because we know this virus is shed in the stool, and it's shed for up to 37 days. So we know those 2 exist. Now, what about the antibody test? The antibody test is rolling forward for FDA approval for some of those. There are several labs who have already come out with their antibody profiles. Again, I typically find, and this is what you're going to see on the information that I'm presenting, you're going to see the information about a week or 2 before finally the government gets on board. We saw that with masks. We saw that with social distancing. Unfortunately, those guys, it takes them a little longer. And a lot of that is because there's a lot of red tape. And you're probably seeing this with why am I not getting my stimulus check fast enough and some of my other money efforts. So government means slower and lots of red tape. That's my little soapbox. So we do have some antibody testing, and specifically I was going to show you with you today. So I've had a couple patients now that have had to test. I've had to go do gown up, a PPE, protective gear, go out and test in the parking lot. And nasal swab wise, they tested positive. They had very low symptoms. Another one I was telemedicine, also very low symptoms, barely had a fever, and the fever was 100.4, which is barely over a low grade. I'll say that again, not 104, 100.4. So again, how I've been talking about, not everybody has a fever. Not everybody has a fever with this. So testing criteria saying you have to have a fever is kind of incorrect, because one of the patients I spoke to yesterday got COVID. Their symptoms started with 1 day of a low-grade fever, then they had a cough and a little hot poker feeling in their chest, mild cough, and then that was it. It didn't go any further. They did test positive. We're currently waiting on their second test, which is 2 weeks later, to see if they still test positive. Now we have another patient who had no symptoms at all, tested positive, and then 14 days later tested them again with the same nasal swab, and they were still positive. So this whole recommendation of 14 days, if you feel better, you can go back out in society, I think we need to be very cautious with that decision, because we may be letting them out too soon, especially since we know this virus can shed for up to 37 days. Remember, that is almost 5 weeks. And so one of the patients that I have that's being tested currently is being observed by the Department of Health, and they did say that, man, that you could be shedding for up to 5 weeks, so we're currently tracking you to learn more. So then one of the other patients, we did a blood draw with this new antibody test, and wouldn't you know, all their IgMs came back as negative. Now IgM means acute presentation of the disease. Those are negative. IgGs were all positive, which means that they've come in contact with this virus, and they have some possible immunity to it. And then there's a third row, which unfortunately doesn't look like it's going to be in the government's approved antibody test, is called IgA. Now, where does IgA come from? IgA is found in the mucous membrane. So you see it in the nose, the sinuses, the lungs, the bladder, the GI tract. It's an immunoglobulin that you produce when you have an infection in those areas. Now, wouldn't you think that would be important, especially with a virus that is found in the lungs and in the GI, to be testing for the antibody IgA? And I think it is. So in this specific patient, like I said, a couple days before we did this antibody test, we did the nasal swab and they tested positive. 2 days after that, we did the antibody profiling. All their IgMs were negative. All their IgGs were positive again, but one of their IgAs for one of the proteins called the spike protein was positive. Now, what does that mean? If they have an IgA positive, that means their body's still mounting an immunological response in the mucous membrane, so they could potentially still be contagious. So bottom line is, guess what? We have to do another nasal swab on them to see if when they clear. So this will be pushing 3 weeks on some of the patients that I'm testing currently. So I think some of the guidelines, I think we're going to see change. I'm bringing this up now so you're not surprised with it later, where this whole 14 days, you're good to go back to work, probably isn't going to be as clear cut. Again, the people that we've seen so far, they've been doing very well. But the concern is if you're hitting the older individuals or the people who have pre-existing conditions. This is another reason why, guys, hey, your health is the most important thing you can invest in. So getting rid of those pre-existing conditions, working on yourself is your priority that you should be investing in so that you do not have those pre-existing conditions that put you at increased risk right now. All right. So when is the antibody test appropriate? Basically, the antibody test is appropriate if you've gotten some respiratory infection and then you've gotten over it and you're wondering, did I have this or did I not have this? It's not appropriate if you're having the more acute symptoms. That would be where the nasal swab or the drop-shipped stool test would be more appropriate in that sense. The other question we have about this that's circulating around is how long is the immunity going to last? There are some small trials coming out of South Korea, I think I talked about in another video, that says that the body may not be mounting an immune response for a long period of time. So that may be only a couple months. Very similar to what we see with colds, where you wonder why, you get 2 or 3 colds throughout the year, you get it again the next year. So it's very possible. We've been seeing people with low antibody responses who have already been infected. So that's some preliminary stuff. We'll keep an eye on that, because some people have gotten reinfected in other countries like South Korea and Hong Kong, which are valid sources. They are not China. They actually are sharing their data. Now, another theory's come up, which is particularly concerning, which can happen. And if you've been a patient of mine or you see us, we see this very, very commonly. They're called stealth or chronic viruses. Epstein-Barr, a lot of the herpes viruses do this. Most of you are probably familiar with chicken pox, and then you get stressed, and then all of a sudden I get shingles later, right? The chicken pox virus lives with you in harmony, and then something with your immune system basically breaks down, and then it comes back out. Well, unfortunately, there is some preliminary research showing that this virus may have the ability to be a chronic virus that then can reactivate. Now, we're hoping that's not the case. If that is the case, then it joins the family of viruses that I treat my chronic disease patients every day with for chronic fatigue and pain and neuropathy. They have chronic reactivated viruses that just live with them, because we do have a lot of viruses that can live in our system, and your immune system, and depending on how healthy you are, it puts those viruses in check. So those are some concerning things that we're finding right now. Now, one other thing I am going to share with you. So yesterday and I posted it on the chat here, there was an article, or it was actually broadcast over the news channel. A group of doctors that are doing something similar to what we have used for years in our clinic, using ozone, medical ozone gas, with blood to treat patients with critical care, meaning they're in the ICU and they're about ready to be intubated and put on ventilation with ozone. And wouldn't you know, again, the N is 36, so it is a very small group. 36 patients were treated with ozone, and of those 36, we only had one patient that needed intubation. Now that's huge, guys. That's an 80% reduction. That is much better than anything else we have out there right now in the front lines. Now, it is a small trial. I want to see some more evidence build on this, but I'm very hopeful as what I see clinically with patients with other disease factors. In our clinic, we see ozone is very, very helpful. And we have used that with some patients who are coming down with illnesses as well. Then today, and I'll share the article for you as well, a paper was actually published out of Italy looking at ozone to be used in this current outbreak. And what they looked at is they basically said that ozone does a few things. It increases something called, or activates, NRF2, which is basically a very important messaging system which can downregulate an inflammatory marker called NF-kappa B. And this NF-kappa B then modulates something I talked about in my first videos called NLRP3 inflammasomes. Remember those inflammasomes we talked about are the reason why we may be having lots of cytokines floating around and overinflammation going on? So it seems that ozone downregulates that system, which is especially helpful. The other thing that it does is it increases your antioxidant pathways. So we know that a lot of patients who are compromised in their lungs have low antioxidant function. Ozone stimulates your antioxidant production in your body. It also increases many other enzymes. It helps reduce the iron overload that I talked about is possible in the other theory in my last video. And it does many different things. It activates your bone marrow. It engages your endocrine system. I mean, we use ozone in everything. Ozone is amazing. I mean, I love ozone. I'm like the ozone guru. I love it. Love it. Love ozone. And what we're seeing, the other benefit is some of these people who are having damage to tissue, which is called ischemia, meaning, you know, they're deprived of oxygen. Ozone works very well here. So a person had a heart attack, or they have an, you know, deprivation in their brain from a stroke, or down in their leg. We commonly use ozone to rehab those people. Well, here it's working to help rehab some of the ischemic injury that is in the lungs and also in the brain, meaning the brain and the lungs are not getting enough oxygen, and ozone is helping in this area as well. And the thing that I'm hearing also, so in our practice, you know, we use multiple different applications of ozone, and some of them are infusion forms, and then others of them are actually just quick injections. Takes less than 3 to 5 minutes to do. And the great thing I'm hearing from my frontline nurses and providers, they are saying that, hey, you know, while we're treating people, we have become infected with this virus, and during this time we have been treating ourselves with injections of ozone and low-dose vitamin C. And by far, of anything we've done, that has been the best thing to get us back on the front lines. Literally, this did not progress into this nasty thing that everybody's worried about. So I think we have some very important tools currently in functional or proactive medicine that we really need to look into further, as I think they're going to shine a lot more than we may see some of the medications, or possibly waiting on a vaccine that may take several months to years to get actually correct and safe, if it even happens. So I hope you guys enjoyed this video. Please, 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 please share this to at least one person. That way we can get the word out, and some of this information becomes available. So if people want to talk to me, or I can help other providers engage in this information, I feel like I'm doing my part to help save somebody else out there. So please share this to at least one person. If you want to talk about any other information, please put that in the comment section. Next week, we're going to talk about exosomes and biological allografts and how do they play a role in possibly reducing this as well. Very, very interesting topic. Hope you guys enjoyed this today. I'm going to try to post everything below, and then when we do a YouTube, we'll try to splice some of these images into you. All right, guys, take care. We'll talk to you later.